Hey ho, let's go. My name is MarkAlain Dery. I'm the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Welcome to our public health video blog. And while you best know the ACOI is the place to turn to for quality CME for physicians, both online and in person, the ACOI has also been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns as well. Hence, I offer you this regular public health perspective. Just a quick mention that it was great to get together again at the ACOI convention and scientific sessions in October. If you couldn't attend, it's not too late to register for the virtual sessions that are available on demand. But hurry before the CME material ends for the year. All sessions will expire from the ACOI site by December 23rd. Now, on to our story for the day. So here's a news flash, right? The pandemic is global, and that means that we're all in this together. Okay, seriously, this is something that we all know, but it seems that we must continually be reminded that the SARS-CoV-2 virus knows no boundaries. It does not stop at any border, and that it should inform our decisions as countries work together to stop the pandemic. As the newest variant, Omicron, has reared its head, causing new concerns about potential effects. The real problem is what has been at the foundation all along: inequity of vaccine distribution. More than half of the world's population has yet to even receive one shot, and this is where the inequity argument comes in. Yet only 6% of the population in the world's poorest country have received the vaccine. Yet here in the U.S. and in other rich countries, vaccine supply indifference is rampant, with doses being wasted and stockpiling of third and fourth doses while countries go without. Now, you'll remember COVAX was formed by UN-backed vaccine alliance to help distribute vaccines to poor nations. Then that promise was scaled back. Now, to make up that deficit, COVAX would literally have to deliver more than 1 million doses every hour until the end of the year. And obviously, that's just not going to happen. Now, according to COVAX, mid and low-income countries will need $4.65 billion to vaccinate 70% of their populations. Our goals collectively should be to ensure that these countries get the supplies they need. And this isn't an entirely altruistic objective, but let's face it, it is especially important because until protection is broadly spread across the world, we all remain at risk with new variants like Omicron popping up. Now, the first case in the U.S. was discovered in San Francisco just a few days ago. That person was a traveler who returned from South Africa on November 22nd and was fully vaccinated. And at this point, that individual's close contacts have all tested negative thus far. But we are continuing to try to plug a hole in a dam that continues to sprout new ones. New variants will continue. For instance, last month at the World Health Organization said less than 10% of the 54 countries in Africa are likely to hit the target of vaccinating 40% of their population by the end of 2021. And Omicron has been identified already in 24 countries, and soon the Delta variant will be old news, since many epidemiologists are now predicting that Omicron will overtake Delta as early as next month. And I totally agree with that. Now, rich countries like the U.S. can prevent more variants. It means helping to ensure that poor countries do get vaccines. This can be done when we meet our financial pledges to COVAX and we stop stockpiling vaccines that will not get used. In addition, vaccine patent protection needs to be waived as well. As a public health advocates, we need to continue to call for the World Trade Organization to adopt a proposal, which was made more than a year ago, by the way, to temporarily waive intellectual property rights so that other companies can produce these vaccines globally and manufacture them. But now this issue is being spearheaded by patient advocacy and human rights groups who are threatening legal actions if countries like the U.S. and Canada do not support the WTO waiver proposal. These groups are contending that obstructing the adoption of the waiver would breach legal duties to perform international human rights obligations. Now, I agree with the head of the advocacy group, Public Citizen, who says that it is clear we should have two priorities at the beginning of the pandemic. right? We should have had two priorities. One should be to augment manufacturing capacity for the vaccine, and the others to make sure that no barriers to the transfer of technology and intellectual property so companies around the world can produce and manufacture this vaccine. Now, we'll be learning more about Omicron, but in the meantime, let's not forget that there are places in the U.S. that are still in a bind with Delta. Vermont recorded its highest total COVID cases since the start of the pandemic, once the vaccination leader, New Hampshire, is now second only to Michigan in new cases per capita over the past week. Coming in third is Minnesota with the most new cases per capita. It's so bad there that even the Pentagon sent medical teams just last month to two major hospitals to relieve doctors and nurses, and more are scheduled to travel in the state to help. So for our patients who are worried about the new variant, our message remains the same. Please get vaccinated. There's still time for us to understand more about Omicron. It's still too early. Very, very early data looks like perhaps it is more infectious than Delta, but hopefully, and fingers crossed, less virulent. So stay on the lookout for these updates, and to read more from these sources used in this report, please go to acoi.org/resources together with the ACOI. Hello, ACOI. Thank you for letting me make these videos. We'll help you have the latest information to help you respond to your patients. As always, feel free to reach out to me directly at madery@mac.com. Thank you, Gina, for another wonderful script.